Hey, Alpha Nurses, I'm Licensure from alphanursguy.com. These are NCLEX practice questions. Without delay, let's get started.
When receiving a client from the post-anesthesia care unit after splenectomy, which should the nurse assess next after obtaining vital signs? 1. Nasogastric drainage. 2. Urinary catheter. 3. Dressing. 4. Need for pain medication. The correct answer is 3. After splenectomy, the client is at high risk for hypovolemia and hemorrhage. The dressing should be checked often. If drainage is present, a circle should be drawn around the drainage, and the time noted to help determine how fast bleeding is occurring. The nasogastric tube should be connected, but this can wait until the dressing has been checked. A urinary catheter is not needed. The last pain medication administration and the client's current pain level should be communicated in the exchange report. Checking for hemorrhage is a greater priority than assessing pain level. Which of the following indicates that a client has achieved the goal of correctly demonstrating deep breathing for an upcoming splenectomy? The client, 1. Breathes in through the nose and out through the mouth. 2. Breathes in through the mouth and out through the nose. 3. Uses diaphragmatic breathing in the lying, sitting, and standing positions. 4. Takes a deep breath into the nose, holds it for 5 seconds, and blows out through pursed lips. The correct answer is 4. The correct technique for deep breathing post-operatively to avoid atelectasis and pneumonia is to take in a deep breath through the nose, hold it for 5 seconds, then blow it out through pursed lips. The goal is to fully expand and empty the lungs for pulmonary hygiene. Platelets should not be administered under which of the following conditions? 1. The platelet bag is cold. 2. The platelets are 2 days old. 3. The platelet bag is at room temperature. 4. The platelets are 12 hours old. The correct answer is 1. Platelets cannot survive cold temperatures. The platelets should be stored at room temperature and last for no more than 5 days. The nurse is teaching a female client with a history of acquired thrombocytopenia about how to prevent and control hemorrhage. Which statement indicates that the client needs further instruction? 1. I can apply direct pressure over small cuts for at least 5 to 10 minutes to stop a venous bleed. 2. I can count the number of tissues saturated to detect blood loss during a nosebleed. 3. I can take hormones to decrease blood loss during menses. 4. I can count the number of sanitary napkins to detect excess blood loss during menses. The correct answer is 2. The client needs further teaching if she thinks that the number of tissues saturated represents all the blood lost during a nosebleed. During a nosebleed, a significant amount of blood can be swallowed and go undetected. It is important that clients with severe thrombocytopenia do not take a nosebleed lightly. Clients with thrombocytopenia can apply pressure for 5 to 10 minutes over a small, superficial cut. Clients with thrombocytopenia can take hormones to suppress menses and control menstrual blood loss. Clients can also count the number of saturated sanitary napkins to approximate blood loss during menses. Some authorities estimate that a completely soaked sanitary napkin holds 50 milliliters. When teaching the client older than age 50 who is receiving long-term prednisone therapy, the nurse should recommend which of the following? 1. Take the prednisone with food. 2. Take over-the-counter drugs as needed. 3. Exercise 3 to 4 times a week. 4. Eat foods that are low in potassium. The correct answer is 1. Nausea, vomiting, and peptic ulcers are gastrointestinal adverse effects of prednisone, so it is recommended that clients take the prednisone with food. In some instances, the client may be advised to take a prescribed antacid prophylactically. The client should never take over-the-counter drugs without notifying physician who prescribed the prednisone. The client should ask the physician about the amount and kind of exercise because of the need to establish baseline physical values before starting an exercise program and because of the increased potential for comorbidity with increasing age. The client should eat foods that are high in potassium to prevent hypokalemia. The client with idiopathic thrombocytopenic purpura asked the nurse why it is necessary to take steroids. Which is the nurse's best response? 1. Steroids destroy the antibodies and prolong the life of platelets. 2. Steroids neutralize the antigens and prolong the life of platelets. 3. Steroids increase phagocytosis and increase the life of platelets. 4. Steroids alter the spleen's recognition of platelets and increase the life of platelets. The correct answer is 4. IDP is treated with steroids to suppress the splenic macrophages from phagocytizing the antibody-coated platelets, which are recognized as foreign bodies, so that the platelets live longer. The steroids also suppress the binding of the autoimmune antibody to the platelet surface. Steroids do not destroy the antibodies on the platelets, neutralize antigens, or increase phagocytosis. A client's bone marrow report reveals normal stem cells and precursors of platelets, megakaryocytes, in the presence of decreased circulating platelets. The nurse recognizes a knowledge deficit when the client makes which of the following statements? 1. I need to stop flossing and throw away my hard toothbrush. 2. I'm glad that my report turned out normal. 3. Now I know why I have all these bruises. 4. I shouldn't jump off that last step anymore. The correct answer is 2. The client who states that the test results are normal has only heard that the bone marrow is functioning. The etiology is in the destruction of circulating platelets. Further tests must be completed to determine the cause. The bone marrow result does rule out other potential diagnoses, such as anemia, leukemia, or myeloproliferative disorders that involve bone marrow depression. The client needs to stop flossing and throw away his hard toothbrush, which can lead to bleeding of the gums. The destruction of the circulating platelets accounts for the easy bruising and the need to protect oneself from further bruising. The client should not jump or increase exertion of joints, which may lead to bleeding in the joints and joint pain. The nurse should instruct the client with a platelet count of less than 150,000 microliter to avoid which of the following activities? 1. Ambulation. 2. Valsalva's maneuver. 3. Visiting with children. 4. Semi-Fowler's position. The correct answer is 2. When the platelet count is less than 150,000 microliter, prolonged bleeding can occur from trauma, injury, or straining such as with Valsalva's maneuver. Clients should avoid any activity that causes straining to evacuate the bowel. Clients can ambulate, but pointed or sharp surfaces should be padded. Clients can visit with their families, but should avoid any scratches, bumps, or scrapes. Clients can sit in a semi-Fowler's position, but should change positions to promote circulation and check for petechiae. When a client with thrombocytopenia has a severe headache, the nurse interprets that this may indicate which of the following? 1. Stress of the disease. 2. Cerebral bleeding. 3. Migraine headache. 4. Sinus congestion. The correct answer is 2. When the platelet count is very low, red blood cells leak out of the blood vessels and into the tissue. If the blood pressure is elevated and the platelet count falls to less than 15,000 microliter, internal bleeding in the brain can occur. A severe headache occurs from meningeal irritation when blood leaks out of the cerebral vasculature. When a client has thrombocytopenia, the nurse should always assess for cerebral bleeding by checking vital signs and performing neurologic checks. Headaches can be caused by stress, migraines, and sinus congestion. However, the concern here is the risk of internal bleeding into the brain. The nurse should instruct the client with a platelet count of 31,000 microliter to 1. Pad sharp surfaces to avoid minor trauma when walking. 2. Assess for spontaneous petechiae in the extremities. 3. Keep the room darkened. 4. Check for blood in the urine. The correct answer is 1. A client with a platelet count of 30,000 to 50,000 microliter is susceptible to bruising with minor trauma. Padding areas that the client might bump, scratch, or hit may help prevent minor trauma. A platelet count of 15,000 to 30,000 microliter may result in spontaneous petechiae and bruising, especially on the extremities. Padding measures would still be used, but the focus would be on assessing for new spontaneous petechiae. Keeping the room dark does not help a client with a low platelet count. With a count below 20,000 microliter, the client is at risk for spontaneous bleeding from the mucous membranes and intracranial bleeding. A healthcare provider prescribes 0.5 milligrams of protamine sulfate for a client who is showing signs of bleeding after receiving a 100-unit dose of heparin. The nurse should expect the effects of the protamine sulfate to be noted in which of the following time frames? 1. 5 minutes. 2. 10 minutes. 3. 20 minutes. 4. 30 minutes. The correct answer is 3. A dose of 0.5 milligrams of protamine sulfate reverses a 100-unit dose of heparin within 20 minutes. The nurse should administer protamine sulfate by IV push slowly to avoid adverse effects, such as hypotension, dyspnea, bradycardia, and anaphylaxis. The nurse is assigned to care for 4 clients. When planning client rounds, which client should the nurse check first? 1. A client on a ventilator. 2. A client in skeletal traction. 3. A postoperative client preparing for discharge. 4. A client admitted on the previous shift who has a diagnosis of gastroenteritis. The correct answer is 1. The airway is always a priority, and the nurse first checks the client on a ventilator. The clients described in options 2, 3, and 4 have needs that will be identified as intermediate priorities. The nurse is administering a medication to a client with myeloid leukemia and does not know the use, dose, or side effects. To obtain the most up-to-date information about this drug, the nurse should 1. Check the physician's drug reference at the nurse's station. 2. Obtain a pharmacology textbook from the hospital library. 3. Consult the drug guide provided by the hospital on the computer or nurse's internet accessible device. 4. Review information at the drug manufacturer's website. The correct answer is 3. The most current pharmacology information is found on electronic sources that are frequently updated and can be transmitted to a handheld device or by logging into the internet or hospital's intranet, if available. The PDR and pharmacology textbooks are outdated once published and, therefore, may not have current information. The manufacturer's website has the potential for bias. A nurse has 2 middle-aged clients who have a prescription to receive a blood transfusion of packed red blood cells at the same time. The first client's blood pressure dropped from the preoperative value of 120/80 to a postoperative value of 100/50. The second client is hospitalized because he developed dehydration and anemia following pneumonia. After checking the patency of their IV lines and vital signs, what should the nurse do next? 1. Call for both clients' blood transfusions at the same time. 2. Ask another nurse to verify the compatibility of both units at the same time. 3. Call for and hang the first client's blood transfusion. 4. Ask another nurse to call for and hang the blood for the second client. The correct answer is 3. When 2 clients are to receive blood at the same time, the nurse should call for and hang the client's transfusions separately to avoid error. The nurse should call for and hang the first client's blood first because this client has experienced a change in blood pressure over a short period of time. The nurse should next call and hang the second client's blood transfusion as there is no indication that this client is unstable at this time. The nurse should not call for both units of transfusions at the same time due to the increased risk of misidentification. The nurse should not verify compatibility of both units at the same time due to the increased risk of misidentification. It is not necessary to involve 2 nurses because the second client can wait until the nurse has time to hang the blood. Which nursing intervention is most important in preventing septic shock? 1. Administering IV fluid replacement therapy as prescribed. 2. Obtaining vital signs every 4 hours for all clients. 3. Monitoring red blood cell counts for elevation. 4. Maintaining a sepsis of indwelling urinary catheters. The correct answer is 4. Maintaining a sepsis of indwelling urinary catheters is essential to prevent infection. Preventing septic shock is a major focus of nursing care because the mortality rate for septic shock is as high as 90% in some populations. Very young and elderly clients, those younger than age 2 or older than age 65, are at increased risk for septic shock. Administering IV fluid replacement therapy, obtaining vital signs every 4 hours on all clients, and monitoring red blood cell counts for elevation do not pertain to septic shock prevention. When assessing a client for early septic shock, the nurse should assess the client for which of the following: 1. Cool, clammy skin. 2. Warm, flush skin. 3. Increased blood pressure. 4. Hemorrhage. The correct answer is 2. Warm, flush skin from a high cardiac output with vasodilation occurs in warm shock or the hyperdynamic phase of septic shock. Other signs and symptoms of early septic shock include fever with restlessness and confusion, normal or decreased blood pressure with tachypnea and tachycardia, increased or normal urine output, and nausea and vomiting or diarrhea. Cool, clammy skin occurs in the hypodynamic or cold phase. Hemorrhage is not a factor in septic shock. A client is receiving dopamine hydrochloride for treatment of shock. The nurse should: 1. Administer pain medication concurrently. 2. Monitor blood pressure continuously. 3. Evaluate arterial blood gases at least every 2 hours. 4. Monitor for signs of infection. The correct answer is 2. The client who is receiving dopamine hydrochloride requires continuous blood pressure monitoring with an invasive or non-invasive device. The nurse may titrate the IV infusion to maintain a systolic blood pressure of 90. Administration of a pain medication concurrently with dopamine hydrochloride, which is a potent sympathomimetic with dose-related alpha-adrenergic agonist, beta-1 selective adrenergic agonist, and dopaminergic blocking effects, is not an essential nursing action for a client who is in shock with already low hemodynamic values. Arterial blood gas concentrations should be monitored according to the client's respiratory status and acid-base balance status, and are not directly related to the dopamine hydrochloride dosage. Monitoring for signs of infection is not related to the nursing action for the client receiving dopamine hydrochloride, which is a priority assessment for a client in shock who is receiving an IV infusion of packed red blood cells and normal saline solution. 1. Fluid balance. 2. Anaphylactic reaction. 3. Pain. 4. Altered level of consciousness. The correct answer is 2. The client who is receiving a blood product requires astute assessment for signs and symptoms of allergic reaction and anaphylaxis, including pruritus, urticaria, facial or glottal edema, and shortness of breath. If such a reaction occurs, the nurse should stop the transfusion immediately, but leave the IV line intact and notify the physician. Usually, an antihistamine such as diphenhydramine hydrochloride, Benadryl, is administered. Epinephrine and corticosteroids may be administered in severe reactions. Fluid balance is not an immediate concern during the blood administration. The administration should not cause pain unless it is extravasating out of the vein, in which case the IV administration should be stopped. Administration of a unit of blood should not affect the level of consciousness. Which of the following findings is the best indication that fluid replacement for the client in hypovolemic shock is adequate? 1. Urine output greater than 30 milliliters per hour. 2. Systolic blood pressure greater than 110. 3. Diastolic blood pressure greater than 90. 4. Respiratory rate of 20 breaths per minute. The correct answer is 1. Urine output provides the most sensitive indication of client's response to therapy for hypovolemic shock. Urine output should be consistently greater than 30 milliliters per hour. Blood pressure is a more accurate reflection of the adequacy of vasoconstriction than of tissue perfusion. Respiratory rate is not a sensitive indicator of fluid balance in the client recovering from hypovolemic shock. Which of the following is the most important goal of nursing care for a client who is in shock? 1. Manage fluid overload. 2. Manage increased cardiac output. 3. Manage inadequate tissue perfusion. 4. Manage vasoconstriction of vascular beds. The correct answer is 3. Nursing interventions and collaborative management are focused on correcting and maintaining adequate tissue perfusion. Inadequate tissue perfusion may be caused by hemorrhage, as in hypovolemic shock, by decreased cardiac output, as in cardiogenic shock, or by massive vasodilation of the vascular bed, as in neurogenic anaphylactic and septic shock. Fluid deficit, not fluid overload, occurs in shock. A client with advanced Hodgkin's disease is admitted to hospice because death is imminent. The goal of nursing care at this time is to 1. Reduce the client's fear of pain. 2. Support the client's wish to discontinue further therapy. 3. Prevent feelings of isolation. 4. Help the client overcome feelings of social inadequacy. The correct answer is 3. Terminally ill clients most often describe feelings of isolation because they tend to be ignored. They're often left out of conversations, and they sense the attitudes of discomfort that many people feel in their presence. Helpful nursing measures include taking the time to be with the client, offering opportunities to talk about feelings, and answering questions honestly. A client is undergoing a bone marrow aspiration and biopsy. What is the best way for the nurse to help the client and 2 upset family members handle anxiety during the procedure? 1. Allow the client's family to stay as long as possible. 2. Stay with the client without speaking. 3. Encourage the client to take slow, deep breaths to relax. 4. Allow the client time to express feelings. The correct answer is 3. Encouraging the client to take slow, deep breaths during uncomfortable parts of procedures is the best method of decreasing the stress response of tightening and tensing the muscles. Slow, deep breathing affects the level of carbon dioxide in the brain to increase the client's sense of well-being. Allowing the client's family to stay may be appropriate if the family has a calming effect on the client, but this family is upset and may contribute to the client's stress. Silence can be therapeutic. But when the client is faced with potentially life-threatening diagnosis and a new, invasive procedure, taking deep breaths will be more effective in reducing the stress response. Expressing feelings is important, but deep breathing will promote relaxation. The nurse can encourage the client to express feelings when the procedure is completed.
You can get my NCLEX course review. Links will be in the description. I'll see you guys in the next video.